Hello, everyone, and welcome back to All About RX. Today, we are exploring the absolute foundation of medical science, anatomical terminology. Think of this explainer as your ultimate mapmaker's journey. We're going to break down the fascinating hidden geography of the human body. Anatomy is all about identifying and describing physical structures, while physiology is the study of how those structures actually function. And by the end of our time together, you're going to have a rock-solid grasp of how the body is organized, and you'll be speaking the exact same precise language that healthcare professionals use every single day. Okay, let's take a super quick look at our agenda. We are basically going to build the body from the ground up. We'll start by clearly defining anatomy and physiology, then move through the levels of human organization and the 11 organ systems. After that, we'll learn the universal coordinates for navigating the body, and finally, we'll map out the body's cavities, quadrants, and regions.
Let's dive right in with Section 1, Anatomy and Physiology Defined.
So to start us off, what exactly are we talking about here? The crucial point to remember is that anatomy focuses entirely on physical structure. It's the what and the where. Physiology, on the other hand, focuses on how those structures actually function, the how. And honestly, the biggest takeaway here is that these two concepts are completely inseparable. Think about it. You literally cannot understand how a heart pumps blood, its physiology, without first understanding the precise chambers and valves that make up its anatomy. They always go hand in hand. Now, when we study these physical structures, we basically have two different zoom levels. On one side, we have gross anatomy. And no, not gross as in yuck, but gross meaning large scale. These are the structures you can easily see with the naked eye, like your major muscles, your bones, and your large organs. On the completely opposite side, we have microscopic anatomy. Just like the name suggests, you absolutely need a microscope for this. This is where we zoom way, way in to study cytology, which is the study of individual cells, and histology, the study of how those cells bundle together to form tissues. Both vantage points are totally essential for a complete map. Moving right along to Section 2, Levels of Human Organization. Think of the human body like the ultimate set of building blocks. We start way down at the chemical level with incredibly simple atoms like hydrogen and oxygen. Those atoms bond together to create molecules like water and DNA. As we move up the ladder, those molecules build cells, the fundamental units of life, like nerve or muscle cells. Then groups of similar cells join forces to form tissues. Different tissues then work together to form an organ, say your heart or your lungs. Those organs coordinate within larger organ systems, like the respiratory or digestive systems. And finally, at the very top of the pyramid, all of these systems integrate flawlessly to form the complete, complex organism. It's truly amazing when you break it down like that. Which brings us nicely to Section 3, the 11 organ systems. All right, our bodies operate using 11 primary organ systems, and they're all working around the clock to maintain homeostasis, that perfect, vital internal balance. We've got the integumentary system, which is your skin, hair, and nails. We have the skeletal and muscular systems for support and movement. The nervous and endocrine systems step in to detect sensory info and regulate everything using hormones. Then there's the cardiovascular and lymphatic systems for nutrient delivery and immune defense. Add in the respiratory, digestive, and urinary systems to handle gas exchange, break down food, and filter out waste. And finally, the reproductive system. Phew, that is quite a list, right? But hey, to easily remember all 11, just use this handy mnemonic. ISKIN-MCRDUR. Yeah, I know it looks a little strange written out, but lock that phrase into your brain and you will literally never forget the 11 systems again. What's really fascinating is looking at how hyper-specific these individual systems are. Take the skeletal system, for example. It doesn't just hold us up. It's intricately divided into an 80-bone axial central core, that's your skull, spine, and ribs, plus 126 appendicular bones making up your arms and legs. Meanwhile, your nervous system acts as the ultimate control center, processing sensory info. Your cardiovascular system is the tireless delivery network, pumping oxygen, and your respiratory system handles that absolutely vital gas exchange. Every single system has an incredibly specific, life-sustaining job. Let's shift gears to Section 4, Navigating the Human Body. Just like any good map needs a north, medical science needs a baseline. For us, that baseline is the standard anatomical position. Picture this, a body standing perfectly upright, directly facing you, with feet flat and palms facing anteriorly, meaning forward. That is the universal reference point. From there, we pair opposites to describe lying down. We've got the prone position, which is lying face down on your stomach, and we pair that against the supine position, which is lying face up. A super easy trick to remember that, just think of the word supine as sky-facing. Now think of anatomical planes as the exact longitude and latitude of our body map. These are imaginary flat surfaces that slice through the body so we can describe internal locations accurately. The sagittal plane is a vertical cut that creates left and right sections. The coronal or frontal plane is another vertical cut, but it creates anterior or front and posterior or back sections. The transverse plane, which is also known as the axial plane, is a horizontal cut, dividing the body into superior, upper, and inferior, lower sections. And the oblique plane? Well, that just handles any diagonal, odd angles that aren't perfectly straight up, down, or across. To actually move along these planes, we use paired directional terms. First up is anterior, also called ventral, which simply means toward the front of the body. For instance, your sternum is anterior to your heart. We naturally contrast this with posterior or dorsal, meaning toward the back of the body. So logically, your spine is posterior to your chest. Next, we have terms that are especially handy for our limbs. Proximal means nearer to the point of origin or attachment. So if we look at your arm, your shoulder is the origin point, making your upper arm proximal. Conversely, distal means farther away from that point of origin. Your distal phalanges are way out there at the very tips of your fingers, as far from the shoulder as they can possibly be. We also use the body's midline. Just imagine a straight, vertical line dividing you perfectly into left and right halves as a major landmark. We use the word medial to describe structures that are nearer to that midline, like your nose is perfectly medial to your eyes. And we pair this with lateral for structures further away from the midline, just like your ears are lateral to your nose. Honestly, it's incredibly logical once you start visualizing it. And finally, Section 5, cavities, quadrants, and regions. Our vital organs aren't just sloshing around in there randomly. They are incredibly well protected inside major body cavities. Starting right at the top, the cranial cavity houses and protects your brain, while the vertebral canal safely encloses the spinal cord. Moving down into the trunk, the thoracic cavity contains your heart and lungs. Just below the diaphragm, the abdominal cavity holds your digestive organs. And nestled right at the bottom, the pelvic cavity holds the urinary bladder and reproductive organs. So why does knowing all this mapping stuff actually matter in the real world? Let's say a patient rushes into the ER with a sudden sharp pain in their lower right abdomen. Where exactly does the doctor look? And more importantly, what specific organ are they worried about? To solve that mystery fast, clinicians rely on a 4-quadrant system to localize the pain. By dividing the abdomen with a vertical median plane and a horizontal transumbilical plane, right through the belly button, they create 4 distinct zones. The right upper quadrant holds the bulk of the liver, and the left upper holds the spleen. But for our patient with that sharp lower right pain, the doctor knows instantly to check the right lower quadrant, or RLQ, because that's exactly where a troubled appendix is hiding. But what if they need even more precision? That's where the 9-region grid comes in. Think of it like a tic-tac-toe board projected right over the abdomen. It's centered straight down the middle with the epigastric region at the very top, the umbilical region right in the center, and the hypogastric region at the bottom. The sides are flanked by the right and left hypochondriac, lumbar, and iliac regions. Knowing the exact grid coordinates of our internal organs is absolutely crucial for making accurate, life-saving medical diagnoses. So, bringing it all back home, mastering this terminology really reveals how beautifully our hidden internal geography dictates our everyday survival. As our core principle states, anatomy studies body structure, physiology studies body function. They are completely inseparable. This lays the absolute groundwork for everything you will ever learn in medical science. So, I'll leave you with this. The next time you feel a weird ache or pain, ask yourself, what exact quadrant, plane, and system is your body trying to alert you about? It's pretty wild to think about. If this explainer helped you map things out, please make sure to like and subscribe to All About RX for more incredibly helpful pharmacy and medical guides. Keep exploring, and I'll catch you in the next one.